Good morning, guys. I hope we are feeling all sparkly. Let's talk about what happens next after you've had your new patient consultation with me. It's a 90-minute consultation, and that time flies, I'm promising you. And it's information overload. So when guys come and see me, there's obviously a mix of emotions, but it's really healthy to offload all of that emotion and realize you're taking a very important and necessary step forwards. And what's even more important is that it's a positive step. In that 90 minutes, we have discussed pretty much everything. And if we do start treatment, I am confident it's in your best interests, and you should be confident that it's also in your best interests. We go over safe and effective injection technique. It's demonstrated. You have your first injections, and you are sent on your merry way with 3 months worth of medication. Needles, syringes, drugs, everything that you need. And you get a nice little fancy bag as well. You also get an information pack. Because as I said, it's an awful lot of information to take away. So we want you guys to walk away with confidence, not only that you are assured that we are acting in your best interests, but we've got your back. So we are always available. But most of the information that you're going to be wondering about is in this information pack. We also have a private or secret, private I think, a private Facebook group, which is just for the men's health clinic patients, for clinic related issues or questions. And we've obviously got email contact. So we are always available. Information overload. Honestly, Hannah says sometimes they look dumbfounded or shell-shocked. But hopefully everybody realizes that they are taking that step forwards, and they should take it with confidence. So what is in this information pack? Well, we've got your TRT protocol clearly demonstrated. I also email you a copy of your TRT protocol. We talk about possible side effects and what you should expect in the first few weeks, and what testosterone level you should expect. Now, we've spoken about this. There is no one-size-fits-all protocol. There is no one-size-fits-all model, and your experiences will be different to the next person's. And one of the most important aspects of care is realistic expectations. So, well, in 2 weeks, I felt like well, in I felt ooh. And it's like, if you compare your experience to somebody else, it can be reassuring, but more often than not, it can lead to a little bit of insecurity. Well, why have I not felt like that? And guys, when they present to clinic, they always have an element of low mood, anxiety, and depersonalization. It can be very minor. And it's important to appreciate in the first few weeks, your drug levels need to stabilize. So peaks and troughs, peaks and troughs. We minimize peaks and troughs with daily injections, but you will still have a period where your levels will be increasing, and that normally is very positive. However, sometimes it can be disappointing, because everybody reacts slightly differently to testosterone and HCG. So we have a telephone consultation at 5 weeks. Now, are you stable at 5 weeks? And the answer is no. And we do a blood test at 4 weeks. So you're definitely not stable then. But why do we do a blood test at 4 weeks and a telephone consultation at 5 weeks? It's to predict and prevent a problem. So if you look at the half-life of HCG, which is about 2.3 days, you are going to be stable in about 11 days. So guys often feel a qualitative improvement in their psychological well-being. Quite quick, actually. But I will make no promises about whether you do feel better. But some guys do notice an improvement in their sense of well-being quite quickly. Then you've got to wait for the testosterone ester to build up. Now, traditionally, cypionate has been believed to have a half-life of about 9 days. In reality, the pharmacokinetics of cypionate and the pharmacodynamics mean that whilst it's nice to give you a number, in reality, it doesn't work that way. Now, I'm a massive proponent of subcutaneous injections. Not only are they less painful, they cause less aromatization of testosterone to estrogen. So we don't want to spike estrogen. We want your estrogen to be appropriate for your free testosterone and DHT. So subcutaneous injections, they can take a little bit longer to raise your levels than intramuscular injections, but the long-term benefits far outweigh the idea of not only pinning so regularly, but also risking peaks and troughs. So we want stable levels. So we don't want to. I actually don't want you to feel amazing straight away, because when you feel amazing straight away, it's often a bad sign. It's often a sign that when you are stable, you're going to have high estrogen, and then you are going to feel rubbish. So a lot of guys do actually talk about this. I felt great for 2-3 weeks, and then this last week, or 2 weeks, I've started to feel a dip. And invariably, that's because the testosterone to estrogen ratio is slightly abnormal. So they go past that peak, the peak ratio, because their levels are still building up. So we see, guys, stability tends to be between 4 weeks if you've got super low SHBG, and about 8 weeks. So our review at 5 weeks, reviewing the bloods at 4 weeks, is to allow me to effectively titrate your protocol so that when you are stable, fingers crossed, you are ready to rock and roll. So prevention, the NHS adopts a very much firefighting model. If you look at their model with regards to libido, stat dose, loading dose at 6 weeks, and then blood test at 12 weeks, and everybody returns to normal. The pre-treatment levels or roundabout. So I mean, it's an ineffective way of managing people. So the traditional way of looking at testosterone replacement therapy monitoring is to wait until you are stable before adjusting your protocol. But if you've got the knowledge and skill to look at somebody's blood work and say, okay, you are going to be in trouble when you're stable with high estrogen, or I don't believe that your levels will be high enough, or they will be too high, then we should prevent that from happening. always thinking. So, there's method to the madness, promise you. So, shall I say so one more time? I like so. So we give you a summary of what's expected from reviews to blood tests. So we then have your 10-12 week review, which is a formal review when you are stable, and then you have 6 monthly reviews after that. And we discuss about the potential need for interim protocol changes. Because everybody reacts differently, there is a titration process. So there's a little bit of tinkering to get you optimized and feeling great. It's important to appreciate that your physiology changes on testosterone replacement therapy. So what do I mean by that? So obviously your goal is normalization of your melandrin levels. I'll give you an example. Somebody with super low SHBG. When we normalize their melandrin levels, what tends to happen is that SHBG creeps up. So at 11, 12 weeks, when we review you, and hopefully you're stable and firing on all cylinders, it doesn't necessarily mean that you're going to be firing on all cylinders in 2-3 months, because what tends to happen is the SHBG creeps up. We want that to happen because SHBG is incredibly important. It acts as a buffer of your melandrin levels. And Joseph's just writing a blog on this right now. So you've got optimized melandrin levels, and then over the next 2-3 months, your SHBG tends to creep up, and then you have to have a protocol change to get your bioavailable melandrin levels back up to where they were at 12 weeks or roundabout, to make you feel great. And really just to sustain long-term physical and psychological well-being. There are other aspects. So often when you present to the clinic with low testosterone, lots of you have addressed lifestyle, nutrition and exercise. Some of you just have not had the capability. You've had the knowledge that you need to do it, but you just lack that ability to just take that next step forwards and put the work in. So the temptation is for everybody to go mental in the gym. And we want you to get fit. We want you to start eating healthy. We want you to start looking after yourself, looking at things like your sleep, looking at your stress. So an important part of this journey is that support and making you realize that our goal is to get you stable, healthy, fit, and mentally strong. So there's a lot of misinformation out there, and there are lots of false promises, and it's disappointing. But that's when you have people using TRT as a cash cow, and they have very much a sales-consumer relationship, whereas our relationship with our patients is very much a healthy doctor-patient relationship. I will be your doctor. HRH will deal with any administrative matters. The boss. But yeah, it's important to have that assurance or reassurance that somebody's got your back, and we have your back. We will support you in your journey to hormone optimization, because it isn't a simple process. It isn't a wham bam, thank you ma'am, here you go, there's your protocol, you'll be golden. It doesn't work like that. There's lots and lots and lots to take in, and you need to appreciate that whilst we encourage autonomy and responsibility for your own health, sometimes you need a little bit of support. And we aim to give that to you. What else is in this pack? What else is in this pack? Your consent form, where you sign your life savings away to me. No, again, it goes over risks, side effects, your medical history. You're not allowed to use testosterone for performance enhancing. I'll throw you off, and I have thrown people off before. That you're comfortable with injection technique. You're aware of why we're using the medications in the method that we do. Talking to your GP, and this is interesting. We had a patient come in, and he'd spoken to the online providers, and he was being inundated with emails and sell. And he said, this patient said, my GP wants to know which doctor is responsible for my care. Email stopped. Says it all, doesn't it? Which doctor is who will be my doctor? We can't tell you that. That's confidential. Online providers. Oh, honestly, kill me now, or kill them now. And also, we'd like you to tick the data collection box, because we are going to be doing a study to demonstrate how effective microdosing testosterone and HCG is. We will change practice. You'll have your in-body score, which Hannah will have gone over with you in far more detail. She plays good cop, I play bad cop. I like playing bad cop. Injection procedure, so how to inject. There's also links to the videos of how to inject, how to prepare your testosterone, how to prepare your HCG. They're all private, because we do not want to encourage people not under our care to be injecting controlled medications, unlike some. What else? How to store your medications, off-label, unlicensed use, gold standard, monthly costs, how much everything costs. So it's all there for you to read, take away. What other medications we can sometimes use to help you get to where you need to be, and a comments, suggestions and complaints. We've never had a complaint. Well, we have, but from an anonymous person to the CQC, and we all know who that was. They hid their email, naughty people. You know, in a fair, it wouldn't be a fair fight, would it? So, you know, you have to resort to subversive bloody tactics. Never mind. You'll get there one day. You won't get there one day. Even with a CQC registration. So, we are here to support you, to guide you in your journey to hormone optimization. But it's more than that. It's more to help you get physically, psychologically strong to take that next step forwards.